we'll use this right leg. All right, so I'm going to use your palpation manual kind of as a guide. I'm not going to go through the whole paragraph. I'm going to show you kind of how I like to do it in kind of a quick and simple way. But yeah, using the manual right off the bat, gluteal fold will be bottom of the contour of the buttocks, or the glute maximus. You're going to come superiorly, right in the middle, and then travel anteriorly. As you're traveling anteriorly, you find a bony prominence. This greater trochanter is pretty easy to palpate. So I'm on it right there because it sticks into my hand. And then to make sure I'm on it, I have him kind of lift this leg up and just rotate it back and forth. So you can lift it up completely. So it's going to be kind of like this. So keep your knee. There you go. So just like we did with the radial head when we did supination, or with the greater tuberosity on the shoulder, a little rotation there. You can do it in supine as well. We'll just stay standing for now. But it's in line with his pubic symphysis coming across this way, and kind of the middle of his glute maximus. Okay. I could also, get on his crest laterally and kind of come straight down until I'm on that bony surface. Okay. Pretty easy. Just use those landmarks as the technique to get there, and then once you're there, you can use a greater trochanter as a landmark for some of these other structures. Ischial tuberosity. All right, let's get a chair here. So, what are these referred to as? Sit bones. Yeah. Because we sit on them. All right, so yeah, you just you can keep standing.
Standing.
Yeah, keep standing. I'll instruct you here in a second. Come towards me. Just stay there for a second. Yeah, there you go. Yeah, I mean, you're already getting in this position, and I hadn't given you any cueing yet, so it's not what you think.
Great.
So all he's going to do is he's going to flex his leg up. There you go. It's all right. Because we have to get the glute max out of the picture, right? So if I'm going to the ischial tuberosity, I have to get under it and then come medially, and I'm under a lot of tissue and a lot of muscle. So here, when I flex his leg up to 90 degrees, well, now it's on a stretch. So same thing, standing position, posterior inferior approach, hips flex at 90 degrees. Now it's going to be uncovered from the gluteal maximal belly. You can start at the greater trochanter and then travel, kind of medially, a little bit inferiorly. And then as I get on the glute max and under the glute max, I'm a little bit more medial, and then I feel the bony kind of ischial tuberosity poking into my thumb. Thumb is appropriate here as opposed to using, your index and middle finger because it creates that natural curve. What's connected to the ischial tuberosity? Hamstrings. Good job. Yeah. I think other classes are just tired. They just kind of all stared at me. But it's a hamstring tendon. So, greater trochanter, medial. Get on the kind of the inside of the glute max, and then it sticks out right into your thumb. Okay. Go ahead and put this leg down. So from there we'll go to ASIS, PSIS. PSIS is the exact same as we did last time. You remember that, right? Just the dimples on the back side. So let's do the ASIS. So go ahead and face them. All right. So I can lift the shirt a little bit. Yeah. Just untuck it just a tad. There you go. So we want to just see the iliac crest here. So I'm on the top of the iliac crest. It forms this nice, little arch, creating, the pelvis. So I'm on top, and I kind of can use my thumbs or my index finger and middle finger, come down, and as soon as I get on that small bump, that's the ASIS. Same thing, some people will have, like a nice crease there to kind of, follow that iliac crest down. And what attaches to the ASIS? Hip flexor, generally speaking, yeah. Muscle in particular? Yeah. Sartorius. Rectus femoris, sartorius is ASIS, and rectus femoris is AIIS, which we don't have to palpate, okay? So, when we're...
You don't want to palpate the AII.
I think I'm kind of nervous.
You have to go a little bit more... Yeah, okay. When we're looking at ASIS, PSIS, sit bones, ischial tuberosity, we can use this information to look at pelvic symmetry and stuff like that a little bit when we're in the clinic. Go ahead and lay down prone real quick, Andrew. So that'd be ASIS. So I'm going back to the ischial tuberosity just because I want to show you another way to do it. can bring his leg off the edge, come to the side a little bit. Okay? So same thing, his hip's now flexed, right? And so now I can, get under his glute, and you can see it a little bit better here, where I'm just a little bit medial, and I'm getting right there, and it's a little bit easier to palpate and instruct when they're in prone as opposed to standing. But same thing here. In the clinic, we might get him in this position, look at PSIS, iliac crest height, and then, I wouldn't have him flex in the clinic unless I wanted to show somebody I was palpating the ischial tuberosity. I could get him in this position and come under and then go straight and see if there's an obliquity or an upslip on one side compared to the other side. So that'd be just another way to do the ischial tuberosity. All right, go ahead and stand up again. The hip's pretty easy. I mean, ASIS, glute max, glute med. It's when we get to the knee that the tendons like the gracilis, semitendinosus, all these guys you're going to have to differentiate, and we'll get that next week. But TFL, we'll go ahead and face that way. So with the TFL, you use the ASIS as your marker. So we just palpated that, right? Crest, traveling along the crest into the first kind of bony prominence on the front side of the pelvis. I come right lateral to that, okay? So there's a little kind of an indention there. I ask him to shift his weight ipsilaterally to that side, and the TFL sticks into my finger or my thumb. And that one's actually pretty easy to feel. ASIS, just a little bit lateral, and you can feel that draw into my finger, okay? So he's moving towards the side of the TFL, not away. And since it's a muscle, you want them to perform an action or resistance. With the weight shifting like the multifidi, you don't have to have them resist that action, just have them shift, okay? Gluteus medius, same thing, it has a supine position. It has a sideline position, which I'll go over because that's the way I usually palpate or check the glute medius in the clinic. And then it has a standing. So we'll do standing right now. You're going to use the greater trochanter, use iliac crest, come straight down, get on the apex of the greater trochanter. And you're a little bit more proximal to it because that's where the glute medius inserts. So if I'm a little bit off of the greater trochanter, I'm on the musculotendinous part of the glute medius. So in standing, I want him, what muscle action does the medius do? Hip what? Yeah, hip abduction. So in sideline, I'll have him abduct the hip, but in standing, if I have him abduct this hip, he's actually going to activate this gluteus medius because of kind of the Trendelenburg sign, right? When we're shifting and he's lifting the leg, this glute medius is activated to prevent hip drop on the contralateral hip, okay? So that's exactly how we palpate it in standing. I come off the greater trochanter, musculotendinous portion. There's a kind of a little divot or kind of a fossa right there where the medius kind of comes in, and then the glute max kind of forms that contour of the buttocks like this. So I'm here kind of in this superior, lateral portion, and then I'll have him kind of, lift this leg up or shift, and it goes into my fingertips a little bit. So that's the way you would do it.